Thank you for joining in this overview of the Well-Nourished Brighter Futures initiative of the Let's Eat Healthy movement. Childhood nutrition has far-reaching impacts, affecting a child's ability to succeed in school and life. It can also determine future health outcomes, including supporting mental and emotional well-being and reducing the risk of developing chronic diseases. Yet for many children in California, access to nutrition education, nutritious foods, and supports for optimal health are severely limited. This can put children at a disadvantage and compromises their ability to grow up healthy. Systemic issues and other socioeconomic barriers exacerbate these conditions. That is why we must work together across disciplines to leverage each other's knowledge, experience, resources, and creative thinking. By working together, we can identify, test, and effectively scale innovative solutions to ensure children are supported to have access to the nutritious foods they need and environments to help them grow healthfully. By advocating for every child's nutritional needs, we can positively impact educational, health, and wellness outcomes for children and families in California, with a special focus on building nutrition equity for those who need it most. The context of our current environment provides an important lens for our discussion. More than ever, people are concerned about their health and well-being. The global COVID-19 pandemic has elevated the importance of immune function as it relates to our overall health. It has also brought to light alarming issues of hunger and food insecurity, and chronic disease and its related health disparities that exist here in California, the US, and around the world. Chronic conditions burden our healthcare system and reduce quality of life for many children and their families. Children are also affected by extreme weather events, as they are susceptible to impacts of water safety, air quality, and foodborne illness. With widening socioeconomic gaps and inequities, our efforts to fully support the nutritional needs of children has its challenges, but also presents a unique and imperative opportunity. The recent release of the Dietary Guidelines Advisory Committee report has some key elements that lend evidence base to further explore the nutrition needs of children. Published every 5 years, the Dietary Guidelines for Americans serve as the basis for federal nutrition programs, such as the National School Lunch and Breakfast Programs, the Women, Infant, Children Program, or WIC, SNAP, and the Adult and Child Care Food Programs. They also provide guidance for health professionals and educators in efforts to help Americans adopt a healthier diet. But what's even more impactful is that they can serve as a catalyst to spark collaborative action, nutrition policy, and educational efforts, which can increase access to healthful foods and beverages and support adoption of healthy eating patterns in places where people live, learn, work, play, and gather. The Dietary Guidelines Advisory Committee report had a strong focus on the critical need to develop healthy eating patterns across the lifespan. This involves addressing appropriate nutrition and dietary needs to support each life stage, such as with pregnancy, infancy, childhood, and adolescence. In these pivotal life stages, nutrient-dense, high-quality foods provide important contributions to overall dietary patterns. And once healthy eating patterns are established, they can be carried to the next life stage, promoting lifelong optimal health and well-being. There is more support than ever that good nutrition starts in the first 1,000 days of life and helps lay the foundation for a child's future health well into adulthood. There's also a growing body of evidence that suggests that a person's lifelong health is shaped by how well he or she is nourished starting in utero and then on into those early years. Nutrition fuels the growth and development of the brain from the start. It lays the foundation for cognitive abilities, motor skills, and socio-emotional development, which in turn profoundly influences success in school and economic opportunities throughout life. Childhood overweight and obesity continue to be our imperative dilemma. But we have learned that obesity and malnutrition are often linked, and that early influences and even intergenerational factors can increase the risk for overweight and obesity. Such influences have contributed to this growing crisis. This issue is a global crisis, but looking here in the United States and even here in California, this remains a critical issue as well. 18.5% of youth are shown to have obesity, and 42% of adults as well. So, as we aim to create solutions for addressing childhood obesity, we ultimately have to also address the equally important and often interrelated issue of undernutrition. We have an opportunity to focus on the importance of nutrition through looking at nutrient density when considering variety of food and amount of food needed for health. In a recent report, FAO defined diet quality as being comprised of 4 key aspects, looking at variety and diversity, adequacy, moderation, and overall balance. So in summary, a healthy diet contains a balanced, diverse, and appropriate selection of nutrient-dense foods eaten over a period of time. The quality of the overall dietary pattern matters. But just like the obesity crisis, we also have a crisis of poor diet quality. When looking at the Healthy Eating Index score, which is a measure of alignment of eating patterns to US dietary guidelines for Americans, using a scale of 1 to 100, US scores show an average of 59 for overall diet quality. And when looking at age ranges, this picture shows we have much improvement to foster healthier eating patterns, especially in children. Poor quality diets have devastating impacts, resulting in about 11 million deaths per year. Most risk factors for high burden diseases are linked to dietary eating patterns. Over the past few decades, the food environment has changed dramatically. Most notably, there has been a significant increase in highly processed foods, which are widely available, calorie dense, nutrient poor, affordable, and often heavily promoted and marketed. This is widening the gap of healthy food consumption, especially in more disadvantaged populations. Further evidence of a nutrition gap is shown on this chart, which demonstrates that the majority of children and adults in the United States do not eat the food groups recommended in the dietary guidelines. For example, you see here that food groups such as vegetables, fruits, and dairy foods are all underconsumed. To close these nutrient gaps, particularly in low resource and underserved communities, more solution-oriented strategies need to be implemented to improve access and consumption to much-needed nutrient-dense foods that are currently being underconsumed. This could go a long way in addressing the nutrients of public health concern, with children and adults not getting enough of critical nutrients like calcium, vitamin D, potassium, and fiber. There are also key nutrients necessary to support cognitive and neurodevelopment, particularly during infancy and early childhood. School-age children also need a wide variety of nutrient-dense foods to meet their growth needs. These key nutrients are shown here on this chart. These can be found in nutrient-dense foods coming from both high-quality plant and animal sources. Looking at the nutritional needs across the lifespan is an opportunity to reinforce the role of nutrient-dense foods in supporting health during critical life stages. In nature, nothing happens in isolation. Whole foods provide a complex structure, or matrix, that allows the nutrients in those foods to interact in our bodies in very unique ways. And when high-quality foods are eaten together, their nutritional and health-promoting benefits are increased. This is often referred to as food synergy. We are seeing a general shift from nutrient-based dietary guidance to more food-based dietary guidance. The health effects of the whole food and overall dietary patterns should be given more attention than just looking at individual nutrients, since foods are more than just the sum of their individual parts. When looking to address the nutritional needs of children, from brain-boosting benefits to immune health to developing lean muscle and strong bones, and optimizing metabolic function, focusing on a healthy dietary pattern that includes a variety of wholesome foods is critical. Finally, just knowing what good nutrition is not necessarily enough. There is an importance of ensuring that solutions create more access to nutritious foods, while also addressing the context of culture and socioeconomic factors and supporting sustainable and equitable food systems. Children experiencing poverty are more likely to be underfed and undernourished. They're also least likely to have access to safe water, sanitation, and healthcare. And a pregnant mother experiencing inadequate nutrition and poor health is more at risk that her child will not grow up healthy, to excel in school, and ultimately to gain job and economic opportunities, which are pivotal for a thriving future. So ensuring optimal and equitable access to good nutrition for women and children can set the foundation for lifelong health. And these investments go a long way in benefiting whole communities. Feeding America recently provided a report and analysis of how food insecurity is increasing in 2020 due to the COVID-19 pandemic. They looked at the overall US population and specifically state, county, and even looking at certain populations like children. And in the United States, looking at the state level, the projected rate of food insecurity among the overall population for 2020 was shown to be the highest in Mississippi at 24.1%. In North Dakota, they had the lowest food insecurity rate in 2018. But this data shows that they would see the largest increase in food insecurity compared to all other states. And in line with being the most populous state, California would see the largest increase in the number of people experiencing food insecurity at 2.1 million, as well as having the largest total number of overall people experiencing food insecurity at 6.4 million. The trauma associated with the pandemic and the increase in number of families facing food insecurity could make academic achievement gaps wider for our most vulnerable children. Millions of children and their families rely on the critical safety net provided through federal nutrition assistance programs, such as the U.S. National School Lunch Program, the School Breakfast Program, and many others. And according to research, participants in these school meal programs consume more nutrient-dense foods overall than those who do not participate. School meal programs also play an important role as a community solution for nutrition adequacy, and this supports not only a child's health, but their ability to learn as well. Research suggests that consumption of nutrient-dense foods made readily available in school meal programs, like fruits, vegetables, and dairy foods, is associated with improved academic and health outcomes among children and adolescents. In addition, teaching nutrition education can increase acceptability of healthy school meals and support school food service efforts. In the United States, students receive less than 8 hours of the recommended 40 to 50 hours that are shown to support behavior change each year. So we have an opportunity to improve the amount of nutrition education and the quality of nutrition education that students receive. Nutrition education has the opportunity to play a part of a larger systems approach to health, delivered in combination with healthy foods provided through schools, communities, and healthy community policies. It can exist in a variety of learning settings with diverse audiences, from classrooms to gardens to community centers. And evidence-based nutrition education as part of the socio-ecological model has the power to positively change individuals, families, and communities. And nutrition education also has an opportunity to integrate into California's social and emotional learning guiding principles. Put simply, this means that there is a need to address all determinants of a child's health, well-being, and success in school, building equity by providing opportunities for all students to build socio-emotional learning skills, and maximizing resiliency in their families, schools, and communities. Working collaboratively, we have an opportunity to take bold strides in supporting children's overall nutrition and supporting their health and well-being. An example of this in action is the recent Healthy Drinks, Healthy Kids, a campaign from Healthy Eating Research and Robert Wood Johnson Foundation. Through collective efforts, they brought together an expert scientific panel with representatives from each of the reputable key national health and nutrition organizations shown here to develop comprehensive beverage recommendations from birth through 5 years of age. The campaign included guidance based on the best available evidence and provided consistent messages that can be used by healthcare providers, public health practitioners, and parents, as well as caregivers, to improve the beverage intake patterns of infants and young children. The consensus statement presents the expert recommendations and provided an overview of the evidence for why certain beverages are or are not healthy for young children. The recommendations very clearly encouraged plain milk and water as go-to beverages for young children ages 0 to 5. For young children, establishing healthy beverage intake patterns early on in life is important for their future health, which is why this campaign is a great example of an innovative and impactful solution to supporting overall children's health. That brings us to the opportunity we have today to come together across disciplines and sectors to foster shared learning and development. And we can do this through the Well-Nourished Brighter Futures initiative, supported by the Let's Eat Healthy movement. Through collaborative action, we can work towards our shared goals in supporting healthier, nourished children. This sentiment guides our value and commitment to why collaboration is so important. If you want to go fast, go alone. If you want to go far, go together. We look forward to embarking upon this important journey together with you. Thank you.